and we will follow up on some information from our last meeting from Capers. I'm attempting to wear Melissa out in presenting some interim work for us today, and appreciate research bringing that. We will start with bill introductions, and please, welcome to committee. Derek Fletcher, I believe? Yes.
Officer for Beneficent Fiduciary Financial, and would like to introduce RS 2497, which is an act concerning captive insurance for technology-enabled fiduciary financial institutions.
Thank you. Are there any questions? Is there any objection? And without objection, the bill will be introduced. Thank you. And thanks for bringing the matter to us. Appreciate that. So, are there other bill introductions? So I do know of another one that we may do just a little bit later, so we may come back to that item, or I will throw it in. So thank you for being with us for our visitors. Appreciate that. And we will take a moment if Director Conroy will join us and bring us up to speed on what we were asking and what additional information you put together.
Thank you, Mr. Chairman, and good afternoon. I think Representative Riley at the last meeting had requested looking at Capers long-term returns. We'd provided looking back 25 years, and I think the specific question was, how would things shake out if you added 5 more years? So you looked at not, 1, 5, 10, 25 years, but you added and you looked at the 30-year period. And on the first page there, you can see, of course, that 26.3 from the 1 year, but if you add the 5 years, 25 years, we're at an 8% return. A 30-year return, we're at an 8.9% return. And if you really like the details, on the back of this sheet is the information year by year, and so you can see those, adding those 5 additional years. 4 of the 5 were very, very positive. And again, that dotted line is that assumed 7.75% rate of return. Again, the 2021, that 26.3 is the 3rd highest in fiscal year returns since 1976. So certainly a very positive performance, but you can see the other years, and of course the big downturn, 2008, 2009, and 2001, 2002. So the answer is, if you look back 30 years, a return of 8.9%.
So thank you for the information. Committee, any questions? Yes, Representative Smith.
Thank you, Mr. Chair. Mr. Conroy, we owe some back non-payments. Do you know how many years that we didn't make payments?
It was right at a quarter of a century. So for about 24, 25 years, the state always paid something. And again, the state's paying for state and school. But for 24 years, the actuary set that employer contribution rate should be this. And for 24 years, the state ultimately picked some lower amount. The difference didn't go away, rolled to the unfunded liability, and we're charging that 7.75%.
Thank you. Thank you, Mr. Chair.
Thank you. Other questions, committee? So thanks for that question. In the 90s, I remember sweating the details of those numbers in great detail every day. And that was an era when I was trying to talk people out of expected returns over 12%. And to see those numbers added back in, I didn't think it would make that big an impact on the 30-year return. So anyway, Representative Neighbor.
Thank you, Mr. Chairman. Alan, are we down to just 2 years now in being short on that Capers refunding out of the 25?
For those missed payments in 17 and 19? No, actually, there's still, there have been 4 or 5 years where those payments have been made, so there's still, depending on which one, but about 16, 17 years left to go on that. On the amortization period of the big unfunded liability, we're down to about 12 years on a 40-year amortization, so making progress there.
Okay. Thank you very much. Thank you, Mr. Chair.
Seeing no further questions, thank you for further addressing our questions. Committee, I'm going to return briefly to the item of bill introductions, and I will introduce a bill on behalf of Ed Klump. The RS is 2629, and it is regarding the expansion of the DROP program to all KPNF members. So I may be able to answer some questions if you have them. I may not. Is there any objection? Seeing no objection, the bill is introduced. So thank you, committee. Are there further bill introductions? Seeing none, we'll move into our agenda for the day. And Ms. Rennick, if you would just help guide me how we best move through the interim reports that we have, I would welcome your guidance as well as your information.
Thank you, Mr. Chairman. Committee members, I was asked to highlight reports that have interim committee reports that would have relevance to this committee. And KLRD has already published 16 interim committee reports. I will not be reviewing 16. That's the good news. And we do have some additional reports being finalized this week. The work of this committee and the 2021 legislature and its interim are addressed by at least 3 interim committees. You have those reports before you. That is the Special Committee on the Federal 340B Drug Program, the Joint Committee on Pensions, Investments, and Benefits, and the Healthcare Stabilization Fund Oversight Committee. For each of these committees, I will briefly highlight its study topic or charge, its membership, and its general findings. I would also note there is another report that will be of interest to this committee. It's in its final stages of publication, and that is the 2021 Special Committee on Mental Health Modernization and Reform. This report is issued by the second special committee that has been formed on this topic, and it looks at a broad array of topics relating to the state's behavioral health system, both inpatient and outpatient services, the current capacity for the workforce, the impact of state policies on treatment of individuals with behavioral health needs, and the steps that would be necessary to modernize the state's behavioral health delivery system. The special committee, again, utilized 3 working groups, which included committee members, behavioral health representatives, and state agency officials. Of interest to this committee is one of the 3 working groups focused on delivery of behavioral health services via telehealth, including the topic of payment parity. This is an issue that has come before this committee previously, and once published, we will make sure you have access to that report, which does include a report from the 3 working groups and their associated recommendations. So I think that will be a very timely report once it is published. All of the interim committee reports that are published are available at www.ks.gov, klrd-web/committees.html. And so there will be a way to access each of those individual committees as well. And that gives you access to links to the legislature's website, the agendas, the testimony, and related committee resource documents that KLRD and others have prepared on the topics assigned to those committees. So the first committee is related to your insurance topic, and that is the Healthcare Stabilization Fund Oversight Committee. The Healthcare Stabilization Fund Oversight Committee was created by the 1989 legislature, and it is described for its function in KSA 40-3403B. The law charges this committee to report its activities to the Legislative Coordinating Council and to make recommendations to the legislature regarding the Healthcare Stabilization Fund. This report is required to be made available to the LCC must also include an analysis of the market for insurance for healthcare providers and recommendations on ways to reduce claim and operational cost to the Healthcare Stabilization Fund. This is an unusual legislative committee in that it has 11 members, with 4 of them being currently serving legislators. 4 are healthcare providers, 1 represents the insurance industry, and 1 is a person from the general public who has no affiliation with healthcare providers or the insurance industry. This happens to be former Representative Marvin Klebb. He was named chairperson of this committee this past year, and as the chairperson of the Healthcare Stabilization Fund Board of Governors, or that person's representative, also serves on the Healthcare Stabilization Fund Oversight Committee. Of interest to this committee is implementation of a bill that you're very familiar with from last year, and that was House Bill 2480, which was ultimately passed and provisions enacted in House substitute for Senate Bill 78. Additionally, this of interest to this committee is the issue of affordability and adequacy of professional liability coverage for Kansas healthcare providers. At its November 16, 2021 meeting, this committee received updates from the Board of Governors, including its actuary, chief counsel, and executive director. The committee also received reports from healthcare providers and an insurer to provide perspectives on the current marketplace for medical malpractice insurance, the need for legislative oversight, and the adequacy of the actuarial report provided by the board's actuary. The committee report outlines these individual reports, beginning with the report on the fund from the fund's actuary, Willis Towers Watson, that's found on page 5 of the report. You will note that the actuary provided 3 separate reports to the Healthcare Stabilization Fund Board of Governors. This is unusual, and the reason for that is relevant to the latter 2 meetings being necessary and reports for the legislation that was being considered by the 2021 legislature. The actuary reviewed the fund's position, including its assets and liabilities, as well as the rate level or surcharge indications for calendar year 2022, and also addressed claims experience and those rates and experiences by individual provider classification. The report of the Deputy Director and Chief Counsel begins on page 8 of the report, and this report includes the fiscal year 2021 medical professional liability experience based on all claims that were resolved and involving the fund in fiscal year 2021. Also highlighted in her report was the experience of the self-insurance faculty and residency programs at the University of Kansas and at WIGME, the Wichita Council on Graduate Medical Education. Remarks were also made specific to COVID-19 claims and concerns, 2020 special session law and 2021 law related to adult care homes and claims of negligence. And that discussion is outlined on page 9 of this report. The committee also received an update on the current medical malpractice insurance marketplace and the healthcare provider insurance availability plan. This is an insurance plan that's unique. It provides insurance access for providers who may not be able to get that insurance in the commercial marketplace due to prior claims, affordability issues, or the nature of that individual's work, such as attendum locums who might be working or covering an ER over the weekend. The testimony outlined a number of concerns that are termed in this report as headwinds, and that they impact the ability to provide affordable and adequate medical malpractice insurance in Kansas. Those topics are outlined on page 10 of this report. The report also includes comment from the Kansas Medical Society and the owner and representatives of a freestanding birth center in Kansas, and those comments begin on page 12. The report finally also includes a statutory report that was submitted by the executive director for the fund, which highlights the fund's position, selected surcharge rates, and overall revenue. And comments were also provided on contemporary issues that the Board of Governors is monitoring. A key part of the discussion and influence of the committee's conversation was House Sub for Senate Bill 78. And so I thought I would show you a slide that actually is very helpful in representing the discussion and the work that you did as a legislature. Give it a second to pop up. So if you will recall, House Sub for Senate Bill 78 increased primary coverage limits from $200,000 per claim and $600,000 annual aggregate to $500,000 per claim with an annual aggregate of $1.5 million. And those new limits did not apply to claims that occurred prior to the 2022 policy effective date. So essentially what happened with insurance rates as with the law passing is some of that obligation that had been on the Healthcare Stabilization Fund was transferred to the primary insurer. So there was an overall rate reduction for calendar year 2022 Healthcare Stabilization Fund surcharge, but there may have been a corresponding increase in the primary rate. And so the actuary was able to demonstrate what that translated in terms of pricing for rates for 2022. But that's a visual way of seeing exactly what the Senate Bill 78 was intended to do and what has happened with those rates. The actuary addressed that led the impact, and this is a slide from the actuary, Willis Towers Watson. We also heard from the primary insurance carrier for many healthcare providers, CAMCO, and the executive director of the Board of Governors as it applied to the filing and approval of rates in forms that were associated with House Sub for Senate Bill 78. The committee learned that implementation was on track and that all of those files and the rates had been approved by the Commissioner of Insurance. The Medical Society also addressed the rebalancing of rates that you see here on the slide, and also the private marketplace for medical malpractice insurance, and the impact of higher limits on coverage overall. So that was just an example, Mr. Chairman. I will show you also, finally, we'll get to what did they direct for discussion. So I'm going to pull up there, if you will turn to page 3 of the report, and I will also highlight here. So among the findings from the Healthcare Stabilization Fund Oversight Committee was to provide comment on the fiscal year 2021 experience and concerns regarding the reserves on known claims and the flattening of investment income. This is an important finding because the Healthcare Stabilization Fund, as a fund, has 2 sources of revenue: surcharge from healthcare providers and investment income. That income is invested through the Pooled Money Investment Board through an investment strategy that's adopted by the board and subject to statute. And so those are the 2 sources of income. And so there was a concern again regarding the flattening of investment income. Comment was made on the implementation of House Sub for Senate Bill 78 and the calendar year 2022 surcharge rate option that was selected by the Board of Governors, which results in a 48% reduction for healthcare providers from their calendar year 2021 Healthcare Stabilization Fund rates. Comment was made on the Board of Governors' investment policy and strategy, marketplace conditions, and those concerns about the emerging headwinds, COVID-19 specific concerns, professional liability coverage for those birth centers that made a presentation, as well as language being continued in this report regarding the fund being held in trust. The committee recommended that its oversight and monitoring and reporting on the fund be continued and that no separate independent actuarial study was warranted. Mr. Chairman, that is the first report. Would you like me to take questions on the individual reports?
That would be great. Thank you. Thank you for the overview. Committee questions? Representative Dodson.
Thank you, Mr. Chairman. I have a couple just on the part you were covering. On the bottom of page 3, I didn't quite understand the last sentence. This decision will result in a 48% reduction. What does that mean specifically?
I'm going to show you another visual way of seeing that. I think that will be very helpful to see a comparison between calendar year 2021 and 2022 rates.
While you're getting to that, I have another one on page 4, which is the loss of insurance coverage by providers. If you can provide some idea of the extent of that problem.
Yes, we did hear about increased numbers of nursing facilities or other adult care homes participating in the availability plan. So we can give you information on what that increase was for those providers who had to access that. That meant that they couldn't find affordable coverage in the insurance marketplace. That was anticipated and it is shown in those numbers. So this is a comparison here. This is using it's $800,000, $2.4 million of coverage, which was prior to the new law, kind of one of the standards for coverage. So the Healthcare Stabilization Fund Board of Governors balances the cost to each provider group. So they classify them, and this gives you an idea of rates And this is the number of calendar year 2020 providers in each of those classes, the calendar year 2021 rate, and the new rate based on the surcharge option the Board of Governors selected. So a good group, a very representative group, is Class 2. These are physicians who do not perform surgery. Class 2 has just over 4,600 providers, and in 2021, their calendar year surcharge was $1,641. Their new rate, based on the passage of House Sub for Senate Bill 78 in the higher coverage limitation requirements and the rebalancing, putting some of that cost to their primary coverage, that now reduces their healthcare stabilization fund surcharge to $851. So essentially about a 50% decrease.
Thanks, very helpful. Appreciate it.
Was that question a plant, just to? Anyway, no, great question. Thank you, and a great answer. Other questions, committee? Oh, sorry. Representative Osman.
Thank you, Mr. Chairman. Just have a housekeeping question. You said that these were all available on the KLDR's website as well?
Yes, under publications, recent publications, and then there's a link to our interim committee reports.
Thank you. I just, the printed out version on at least this one is black over white over gray, which makes it really difficult to read.
We're trying to hide those and embed those, so we'll reveal them as Easter eggs each day.
Other questions, committee? Thank you for the overview. On page 5, it says the actuary separately address the impact of the new law on the fund for the actuarial impact. Is that mentioned anywhere in here, or is that a separate piece? And was there any meaningful actuarial impact on the fund due to the changes of the law, or was it more due to claims experience and the change in the yield and other factors?
That is discussed on page 6, on the second column, going into page 3, into page 7 in the first column. And so it really was, this will affect their operating costs, would be unaffected by the law change, and also tail coverage and transfer to the availability plan and operating expenses. So this was, you're correct, relevant to the rates themselves. There is an option in the law that has not yet been used where the fund could provide higher limits of coverage. The board is still studying that matter.
Thank you. What was the other limit of coverage that we had discussed? So we had the primary, on both. My apologies to everyone listening there. And then there was a higher coverage level that used to exist and another one that was proposed. What were those higher levels?
The higher level, let's see, I'm looking to make sure if we included that in the report. We did not, but I believe that was at 1 million. So just bringing it up slightly, but I will provide that from House Sub for 78.
Okay, thank you. But the board is looking at whether to continue or whether to actually offer that. It's
Correct.
Not currently offered. They've got it priced to set for the main
Correct.
one.
And it formed a subcommittee and really did study this matter and is continuing to study the matter and the appropriate level of insurance coverage to offer.
So thank you. And then even if we get deep in the weeds of the actuarial report, will we have more of an indication next year after a full year of data? Is there enough that it really shows up yet in the actuarial numbers?
Yes, it would show up in the actuarial numbers. I think the concern will be there has been a slow development of cases that have been moving forward because of COVID-19. Civil cases have not received the primary treatment by the court. That's been criminal cases were first considered. And so there's been a slow return to some of those claims to the courts. If there are higher limits, will there be more settlements? I think those will be things that, as the actuary looks forward, will be that claims and loss experience so that the rates are appropriately set.
So thank you. And then due to that, we might in the short term actually see less in actual claims experience. It would be the projected claims experience that we would be looking towards, but
Right, which was the actuary's concern about the increasing reserves on claims. That was part of the actuary's concern saying that there might have been a slightly worse experience because there are still several things in the pipeline that have not been resolved.
So thank you. And then I think that the summary had been that the stabilization fund needs to raise its surcharge by 3.3% for calendar year 22 to maintain the unassigned reserves. Is that a change that's within kind of the normal year-to-year variance? And how does that stack up in terms of magnitude?
There have been, absent the last 2 or 3 years, no changes recommended. The surcharge has been sufficient. With investment income being the only other source of revenue, slowly we've seen 1 to 3% change in surcharge just to account for that potential loss of revenue and the flattening interest income.
So thank you. Largely due then to the change in interest income. And interesting. So, and then does this board oversee, or it was pooled money that oversees the investment pool, not the healthcare stabilization fund?
That's great.
It's delegated.
The Director of Investments makes regular reports to the Board of Governors on the status of its investments, the laddering policy that's used, and then the board can make decisions and choices based on that within the limits of their statute.
Thank you. With the flattening yield curves, et cetera, has there been discussion of any possible changes needed in the investment constraints that are operated, or is that again outside of the healthcare stabilization fund realm?
You've anticipated what the committee discussed, and one of the legislative members inquired about investment strategies more closely aligned with those of CAPERS. There were some concerns that were stated because this is a group that has to ensure a provider who may incur a claim today that may not actually come until much later through tail coverage, and this could be a 30 or a 40-year experience. And so what's maintained in loss and reserves is very different than a short-term need. So it's very much about whether the board would balance a short-term or long-term, but the board did agree that it would look at investment policy and consider some other options that might have higher yield.
So thank you, and I would not suggest using the CAPERS strategy for investing the healthcare stabilization fund. That time frame and risk would be, I think, materially different, anticipating a more general fund type piece. However, there may be some things that are instructive based on the interest rate risk that is there and that we could pick up. Thank you. Other questions besides my ongoing and terribly exciting questions? Seeing none, thank you for the review of the work that was done on the Healthcare Stabilization Fund, and also it helps us just to get a little bit of a handle on some of the changes we made last year on the fund. So appreciate that. And committee, if you have other questions on that topic, we can dive into them further as you need. So thank you. Back to you.
The second report was from the Special Committee on the Federal 340B program. And the 340B program is a little bit different in terms of being a special committee because it came about because of a budget proviso in the Omnibus Appropriations Bill. It was Section 20, Paragraph C of Senate Bill 159, and it directed the legislature to create an interim study committee on the Federal 340B program. The proviso directed the committee to review this drug pricing program with the objective of gaining a better understanding of how that program is implemented in Kansas and the experience of the participating entities. This was very much a review study committee. It was asked to review the federal requirements of the program, the role that qualifying 340B providers, pharmacies, and pharmacy benefit managers play in the program, the fiscal impact of such program and all participants, any federal or state law changes that affected the program, any recent marketplace developments of interest, and the impact of the program on healthcare payers. It was a 13-member committee with its chairperson to be appointed by the Speaker. And of interest to this committee is the committee reviewed the stakeholders involved in the 340B program, and that included the interaction between 340B covered entities and PBMs. Relevance to legislation in this committee, which is House Bill 2383. This committee held an informal informational hearing last session regarding the legislation and the topic before the committee, including a move whether there would be appropriate to consider licensure of these entities, which are currently registered under Kansas law. KLRD provided a summary of recent state laws addressing PBM reimbursement practices and more broad regulatory bills that are similar to House Bill 2383, and that's available in committee resources, and I'm happy to share that with the committee as well. The federal 340B drug pricing program is a program that allows certain entities that serve low-income patients to receive discounted drugs from manufacturers that participate in both Medicare and Medicaid. Manufacturers who sell these covered drugs must sell them at program prices to Medicaid to cover the drugs. Section 602 of the Veterans Healthcare Act of 1992 added Section 340B of the Public Health Service Act. And that's where the program got its name, and its stated purpose in 1992 was to stretch scarce federal resources as far as possible, reaching more eligible patients and providing more comprehensive services. The special committee received information and perspectives on the history and the growth of the 340B program and states' efforts to specifically address discriminatory reimbursement practices. Those are outlined on page 5 of the committee's report. A summary of the 2020 Rutledge decision regarding an Arkansas law that regulated price reimbursement by PBMs is also provided, and that was provided by a representative of the Revisor of Statutes office. The committee also received comment from safety net clinic representatives, hospitals and pharmacists who participate in the 340B program, and representatives of both pharmaceutical drug manufacturers and PBMs. The comment of the PBMs representative, including concerns about the 340B program growth and beneficiaries of this growth, is found on page 7 of the report. The report also provides summaries of both House Bill 2260. This is a bill assigned to the House Committee on Health and Human Services and is more specific to the discriminatory treatment of 340B covered entities and its providers and pharmacies, and House Bill 2383, which would change the current regulatory environment for PBMs who are currently registered with the Kansas Insurance Department to a more formal licensure scheme and increase enforcement in the department's regulatory role. The summary of that particular bill is found on page 9 of the report. And the committee's findings are found on page 3 in the gray box. And of interest to this committee, the special committee, after considerable discussion, chose not to make a specific recommendation on either House Bill 2260 or House Bill 2383. It noted in its report that it would like to leave this decision on whether a bill receives a hearing in the hands of the respective standing committee's chairpersons. The committee also requested updated fiscal information on the 2 Kansas bills. Mr. Chairman, that is the report of the Special Committee on 340B.
Thank you. Committee questions? Representative Riley.
Thank you, Mr. Chair. And just a heads up, I do have some a balloon later on when we're discussing those. I do have some legislation like that I would like to add to those bills, but I want to go back to this 340B and talk about a little of the history of that, because my understanding from what you said in here is that that was to help out low-income individuals. Is that correct?
And the covered entities that provide the safety net essentially for those individuals or where they may access pharmaceutical medication.
Yes, and so I've had the honor of being able to sit in on some hospital board meetings in our area. And I hear this money coming in, and we are a small hospital. The Ark City Hospital is a small hospital. And there's quite a bit of money that's coming in from Dillon's and different pharmacies around that sign up for this program to the hospital. Where I think it feels like there is a gap in that legislation that is the follow-through on that 340B, is, way I see it, and looking at financials over the last couple of years for the hospital, that money just goes into the general budget. At the same time, there are thousands of dollars that the hospital always talks about that they are writing off of patients that didn't have insurance, didn't have coverage. Those are the low-income, non-insured people for the emergency room, for hospital stays, over and over again, and they write off those bills. Seems like there should be a connection between this benefit for low-income people that's coming in, this income that's coming in comparison to the amount of money that's being written off by these hospitals for different reasons. Thank you.
Further questions? Representative Miller.
Thank you, Mr. Chairman. You'll see my name on the front of the report as one of the members of that 340B committee, and what Representative Riley, the issue that he raises was an extensive subject that we discussed as to the intention of the original legislation, and there was some difference of opinion, but the language is very clear in that it says it's to go to the benefit of the covered entity, which most critically from my view, were these smaller hospitals, FQHCs, who are on the brink of, in many cases, the brink of insolvency without this money to bolster their revenue. I don't know if anyone else is getting the emails that I get. I get a lot of emails from those kind of people because I was on the committee, and you may have started to receive them now. But I would like to take the opportunity to urge the chairman to hold hearings on this subject. Of, at least in some parts of the state, it's a matter of criticality, and I made the motion to recommend that you do it. I lost on the motion that we recommend we leave it up to you, but I'm taking the moment to say, please do it. Thank you.
So thanks, and it's helpful to have members of the committee that were on the interim committees give us more color from the report as well. Representative Riley.
And thank you, Representative Miller. I just agree. I mean, the hospital I'm talking about is one of those hospitals that for years has been on the verge, and this 340B income really helped to help, well, COVID-19 helped also, but helped bring them back as far as income, but there was still a lot of money that they were writing off for people that didn't have a thing. So I would agree with you that we need to have some discussion on that. Thank you.
May I?
Yes.
And their point, the principal point, as I understood the point they were making, is that that's what the money was intended for, but it's currently being co-opted by the PBMs. And that's the debate, and that's what we need to be, if we look at this, that's the eye we need to have on the issue. Thank you.
Representative Howe.
Thank you, Mr. Chairman. Just wanted to voice my support also for having hearings, especially on HB 2383. My constituents have expressed a strong interest in seeing hearings on that sometime in the future. So, thank you.
Thank you all for weighing in. I appreciate that. Representative Dodson.
Thanks, Mr. Chair. When you look at page 6 on the left-hand column there, what we're doing with HR 4390, for example, is the legislation that we're currently working going to be an adjunct to that? In other words, is it going to follow suit with these discriminatory practices? Is that the thrust of what we're trying to do?
It does have a connection, and so there is a movement by Congress. There's also a movement to hold HRSA, the implementing agency, more accountable in terms of auditing and monitoring reimbursement practices, and I would leave it to the revisor, but Rutledge would open the door on states having a role in the regulation of PBM. So this is a move that's happening both at the congressional level and at the individual states are getting ahead of the Congress to speak to PBM practices in their individual states.
I think there's some, for instance, the state of Ohio has done a pretty good job on this, and I assume we're modeling after some of those.
Yes, the committee heard from representatives from both Indiana and a state senator who is also a pharmacist and 340B covered entity representative from the state of Utah. Arkansas also has a comprehensive bill as well. And so that's included in that summary of other states' actions regarding PBM management.
Thank you. Representative Neighbor.
Thank you, Mr. Chair. This is an issue that has been ongoing for several years or has been looked at. One of the problems within what PBMs are doing is they contract pharmacists. And in that contract, well, several years ago, let me lead into this, we passed a bill where pharmacists could recommend a less expensive medication if the doctor approved it. They had a gag order before then, and they could not share that information. Well, in the new contracts with the PBMs now, the PBMs are putting in a gag order in there, in that if you say something to a patient in your pharmacy and you're part of a PBM, you will lose your contract, period. So they're going to say there's nothing out there. I mean, they're operating under contracts, but I think it's deeper than that, and we need to understand what that gag order does and how it affects patients and the pharmacies. So that's a deeper look into it also. Thank you.
Further questions and comments? And then just to be clear, for 2383, is that the bill that deals with the PBM issue generically, or does it go particularly specific to the 340B?
That is the licensure bill, so that's the more complete bill. It could address some of those practices, but it is a much broader enforcement bill, and 2260 is the bill that's more limited to discrimination price reimbursement issues for 340B.
So thank you. Just briefly for the committee on that, the pharmacy folks and our pharmacy benefit manager folks are to be talking this week and next week, and by the 28th, see what of the differences they can identify to come together on, and with your feedback, et cetera, we would look to have a hearing after that date to look at what they found and how we can help everybody move forward on that issue. So, but thank you all for weighing in on that matter, and I hope that helps provide some idea of next steps for us, and glad to work with you all on that. So, other questions, comments? Big issue for us to get our arms around, thanks to those of you who have dug into it, and next steps may not be easy, but we'll look at finding what they can be. On to our next topic.
Okay, just a minute here, and I'll get the right page up. This looks much better. This is, I do want to note that there is a draft report stamp here. That just means that the report of the Joint Committee on Pensions, Investments, and Benefits is out to the committee for its final review, and so that is why you don't have a more complete report and have the draft watermark. And Mr. Chairman, this is the final report to share with you today, and I would note that the Joint Committee on Pensions, Investments, and Benefits was created in 1992, and it is authorized by KSA 2020-46-2201 to monitor, review, and make recommendations relative to investment policies and objectives that have been formulated by KPERS and its Board of Trustees. Review and make recommendations related to KPERS benefits. Consider and make recommendations on the confirmation of members that have been nominated by the board, by the governor to serve on the board. Review and make recommendations related to the inclusion of city and county correctional officers as eligible members of the Kansas Police and Fire retirement system. Review reports regarding working after retirement exceptions and introduce legislation as may be necessary. This is a 13-member committee, and traditionally it meets during the interim. Of interest to this committee, other than pensions being in your title, is that this is a review of the overall health of the state retirement system. It's an update on recent law, including House Bill 2405, which this committee considered regarding pension bond funding. And some of the contemporary topics that are of interest to this committee, and Director Conroy reviewed a few of those last week, including the board's discussion of the investment return assumption rate and the pension administration modernization system. Also addressed at the committee level were the membership for the Deferred Retirement Option Program, or DROP, which we just heard in a bill introduction request, and the KPERS Tier 3 Dividend Formula and Experience. At the committee's meeting on December 8th, it received reports from KPERS on the 2020 actuarial valuation, pension obligation bond proceeds for the 2004, 2015, and the new 2021 issuance, KPERS 3, the activities of the KPERS board, DROP, with comment from the Kansas Association of Chiefs of Police, Sheriff's Association, and Peace Officers Association, the impact of COVID-19 on the retirement system experience, and the Pensions Administration Modernization Project. This report begins with a summary of the KPERS 2020 Actuarial Valuation Report, and that's found on pages 4 and 5 of this report. And the Actuarial Valuation Report establishes the 2020 valuation, which is used to set fiscal year 2024 contribution rates for state school group employers and calendar year 2023 rates for the local employers. And it also serves as an important baseline for any cost study or estimate that might be necessary in the 2022 session. The report was characterized by Director Conroy as good news, with several indicators moving in the right direction. Mr. Conroy highlighted several of these improvements as they were compared to the 2019 valuation, including the overall system funded ratio increasing from 70.0% to 72.5%, and the unfunded actuarial liability decreasing from $9.0 billion to $8.5 billion. Improvements in the actuarially required contribution rates for state school employers were also highlighted, and it was noted, and there was a question on this topic, that all employer groups are now contributing the full actuarially required contribution rate in fiscal year 2022 for the second year in a row. And the report, it's important to note when you think about the legislative action from 2021, the 2020 actuarial valuation does not reflect the actions of the 2021 legislature as it pertains to the authorization of the $500 million in pension bond funding, as that authorization occurred after December 31st, 2020. Some of the employer rates and other contribution information and calculations did include that to give the committee an idea of where KPERS and the trust fund might be going forward. The report also documents on page 5 the status of the pension obligation bonds for 2004C, 2015H, and the new 2021K. KPERS confirmed that the bond issuance and receipt of those funds, the $500 million net proceeds, in August of 2021, and the rate was 2.65%. The report also includes information regarding Tier 3 performance, the investment rate assumption, and the DROP program update on page 6. On the DROP topic, the committee received a request for participation to allow local law enforcement agencies to participate. As you may recall, the DROP participation is currently limited to the KPNF, Kansas Highway Patrol, and KBI agents, and has a sunset date in 2025. An impact on the pandemic on retirements was also provided, and the committee has been reviewing retirement trends with CAPERS these past few years in particular to see if there is any correlation with the pandemic itself. CAPERS also provided an update on the progress of that pension administration system modernization project, and this is a multi-year project that is intended to support automation, provide high-quality tools and communication, and support CAPERS members will need now and into the future, and also maintain the security and integrity of system data. And so those costs began in fiscal year 2022 and will be realized in the budget through fiscal year 2026. And then finally, again, on page 3, you'll find the comments from the Joint Committee. And the Joint Committee noted the improvement that was stated in the annual valuation report and overall fund performance. There are several policy items, and you'll note that often the report refers to the appropriate standing committee, so we will deem you one of those appropriate standing committees. So there are several items that have been given to the 2022 Legislature to review. The first, as the committee held a discussion on the projected SGF ending balance and overall health of CAPERS and the health of the state budget, one of the topics addressed regarded the cost of living adjustment, or COLA, and the committee requested that the CAPERS board review retiree cost of living adjustment and make a recommendation. The committee did say that this matter should be, if a recommendation was made, directed to the standing committees on appropriations and ways and means, and that such adjustment might be funded or prepaid in advance, such as a lump sum payment. On the topic of pension bonds, the committee asked the legislature to consider the possibility of additional pension funding bonds if interest rates remain favorable, or using some portion of this SGF surplus ending balance to make additional contributions to the unfunded actuarial liability. On the topic of layered payments, the committee asked for consideration to the 2017 and 2019 employer contribution deferrals, which total approximately $254 million, and asked for consideration of whether to pay that amount in full or on a more expedited repayment schedule. This is currently a 20-year schedule. The committee also commented for the consideration of expansion of the DROP, that consider expansion, review the expansion to all KPNF, both state and local employers. Again, leaving that to the appropriate standing committees to review the issue. On the topic of CAPERS correctional, the committee suggested that there should be a review of the possibility of a CAPERS correctional option for local jailers. And they heard concerns about having local jailers participating in Tier 3 and the benefit structure for a Tier 3 employee. On the Tier 3 formula, the committee also suggested that there be an ongoing evaluation of the dividend formula to ensure equity and to consider the overall benefit value. And the committee also requested introduction of legislation regarding the sale of state surplus property. And there are requirements now that a percentage of those monies would go into CAPERS to reduce the unfunded actuarial liability. This would end that particular process. That bill has been introduced in the Senate Committee on Financial Institutions and Insurance. And Mr. Chairman, that is a review of the Joint Committee on Pensions, Investments, and Benefits report.
So thank you. Committee questions, comments, or thoughts? Representative Miller.
Thank you, Mr. Chairman. I guess I could wait to see if that Senate bill you just mentioned ever gets over here, but I'm just curious why they would want to undo that statute.
I will let the chairman, he may wish to also reply to that. Again, this is part of that conversation regarding if there is a surplus, is that a necessary transfer, and then there were also some administrative concerns addressed.
So thank you.
That's good enough. Thank you.
Well, and that, as always, research handles things well, but what many felt had been happening is when there was a sale of a property identified, accompanying that legislation was something that said this didn't apply. And perhaps it could be directed somewhere else. So while the intent was useful, and in particular, and followed in some cases when we were in more dire financial straits, it got to where it might have been a disincentive to sell surplus property, and the sense was that perhaps it will be more efficient just to take it off the books rather than make people work around it. Nonetheless, is something we'll need to look at a little bit more with the bill than just say, yeah, it's time to take it off. So thanks for the question. Representative Dodson.
Thanks, Mr. Chair. When I think it was on Monday, there was discussion on the assumption for the rate of return, and it mentioned the number 6.5, vice 7 that's in the report. Was the 6.5 derived after the closure of the report?
The committee heard from the capers, the report that Director Conway provided from the board was where where the state fit in a broader look at 131 different pension systems. And so I think 6.5 was presented as a particular standard, and then that gave the committee an option to look at what would happen if that rate changed by a quarter of a percent. And so that was part of the discussion, was what would that then change the overall unfunded liability, and what would the impact be on the funded ratio?
Thank you.
Thanks for the questions. Other questions or comments? So thanks for your attention to all of the matters that are there. Looking at a few of the details, a lot of good news that is there. The dividend formula is one that I had concern on, and that's on page 5 and 6, and particularly the last 2 years I had concern on that. But my concern has waned, and I appreciate the executive director giving us where we were at. And as is pointed out in the report at the end of that section on page 6, the expectation is we'll be a little north of 4% with the returns that we have had. And if you look at the formula and the value of Tier 3 benefits and equity across employees over time is something I think we will want to continue to look at and how that works. However, I had a hope that we would get to a 6% return of interest in total, 4% guaranteed, and a 2% over time average of the benefit being paid out. So I'm very pleased that returns have been so adequate in the fund that that's hit 4.4. And in the near future, while we still need to watch what's happening, as we look at the calendar year returns, and if the executive director is still in the room and can guide me if I'm way off, we're looking at 15 to maybe a little bit more for 2022. We were around 11% for 21. We were around 17% for 19, 20, 21. I was a year off on that. But going back, something 15, 16, 11, 17. The importance of that is those 3 years are in the next couple of years of a 5-year formula. And that's going to be particularly helpful to buoy what would be paid out in the formulaic dividend to those employees. But an important thing to watch, if we're garnering those kind of returns, they will do very well. But our expected return assumption now may be materially different than even 7 3/4. If that's the case, what does that look like, and how does that treat our Tier 3 employees, and how might we want that to go going forward? And as we know in legislation, it is not set in stone, and it will be important for us to continue to look at that formula and how that works for both the state and employees going forward. But the short term, it's pretty good news, and short term being 3 years. We will be looking at some of the other pieces that are there. The questions that we always have are just what does it cost? And what does it cost the system as we work through? One piece that I did want to point out as we get towards the end of the report, the working after retirement statutes. We did talk about, do the committees want to talk about some of the constraints on working after retirement, and in an era of tight employment, should or would we consider changing those, the waiting period, or perhaps other things to make it more possible to bring someone back who has retired, and in what cases might we? And in those cases, we'd look at both how we open that window and how we would close that window to stay in compliance with a policy that is good with the IRS. But if there are ways without significant cost that we could help folks to potentially do that effort, is another topic we can bring up in the committee, and I would welcome the committee's feedback on that as well. Did I stimulate a thought with that? Okay. Okay. I will see if I'm trying to remember if there are some other things that I wanted to take advantage of pointing out. I think those were two things that I did want us to go a little deeper in. I had not asked Capers to go through that investment return assumption in terms of the payout on the formulaic formula. If the committee is interested in seeing more information on that, I know they have that presentation that they did give us in the joint committee, and we could look at that in more detail. So thanks for listening to those thoughts. Any further questions? Seeing none. Thank you for presenting all of those topics, and more than that, thanks to all of the work that legislative research had to do behind going through the meetings and assembling these reports for us so that we can take advantage of the work of those interim committees and work to move forward from there. Do you have anything off the top of your head as it relates to the emails that we would have gotten so far on the mandates and where we are at? And even if we just kind of review where we were and how, if we move forward on those topics, how we would go from here?
Sure, Mr. Chairman. Committee members, today was the day that the committee had specified that it receive information from the State Employee Health Plan and the Healthcare Commission regarding House Bill 2110, which is the PANDAS benefit bill, and separately House Bill 2129, which relates to tobacco cessation benefits. The committee had asked for the State Employee Health Plan's assistance in preparing the social and economic impact factor report. We have received both of those reports as of today, this afternoon, and those reports, one was completed by Siegel Consulting for the PANDA, and so there's some information regarding that report, and separately, the commission itself prepared the report for the tobacco cessation benefits. And so this is information that would give you information about those factors that are required by state law for proponents to the bill to address in terms of cost, prevalence, some of the factors that are associated with providing a new benefit or a provider mandate in Kansas.
Thank you. So the goal of trying to wear Ms. Rennick out today on presentations was just some of those items that we can carry forward, and we will look forward to how we do that. Are there any other questions or comments on those topics that we have gone through? Okay, next week we will be meeting on Monday and Wednesday. We will add some hearings to that schedule. We'll look at things that are ready for us to step into. I will consider, Capers has a board meeting coming up for 2 days, so I don't want to surprise anybody with anything major, but we'll try and start working through the items that we have on the agenda. So look for an update in particular to Wednesday's agenda as we look for the bills that we will be hearing on those days and getting after our work. Thank you, and we are adjourned.